For the best medical and paramedical lectures, subscribe to our channel and press the bell icon to stay connected with us.
Hey guys, in this lecture we will talk about polycythemia, but first of all please subscribe this channel. Polycythemia. Polycythemia is an increased number of red blood cells in the blood. In polycythemia, the levels of hemoglobin, hematocrit count may be elevated when measured in the complete blood count as compared to normal. Polycythemia is characterized by an increase in absolute quantity of red blood cells or total RBC volume. In contrast, relative polycythemia is secondary to fluid loss or decreased fluid intake resulting in hemoconcentration. Polycythemia can result from internal problems with production of red blood cells. This is termed primary polycythemia. Therefore, not only are RBC involved, but also white blood cell and platelets, leading to increased production of each of these blood cells. Types of polycythemias: primary and secondary. Polycythemia vera. Polycythemia vera begin with one or more DNA mutation of a single hematopoietic stem cell. Most cases of polycythemia vera are not inherited. These conditions associated with genetic change that are somatic and are present only in present cell. Secondary polycythemia can be either hypoxia independent. In hypoxia-driven secondary polycythemia, hypoxia stimulates erythropoietin production in kidney, which in turn stimulates RBC production. Polycythemia primary causes: inherent or acquired problems with red blood cell production. Polycythemia vera is related to genetic mutation in the GAK2 gene, which is thought to increase the sensitivity of bone marrow cells. Polycythemia secondary causes: overproduction of red blood cell result from increased sensitivity or responsiveness to EPO. The main reason for higher than normal EPO are chronic hypoxia. Some of the common conditions that can result in elevated erythropoietin due to chronic hypoxia: COPD, chronic bronchitis, pulmonary hypertension, hypoventilation syndrome, congestive heart failure CHF, obstructive sleep apnea, and cigarette smoking. Pathophysiology. This is a brief form of what we discussed. Clinical manifestation: bleeding, blood clot formation, bone and joint pain, headache, itching, fatigue, dizziness, abdominal pain, bruising. Diagnostic evaluation: history, medical history, family history, social and occupational history, physical examination, complete blood count, chest X-ray, electrocardiogram, and bone marrow biopsy. Medical management. For secondary polycythemia, supplement oxygen can be provided for individuals with chronic hypoxia. For primary polycythemia, self-care at home, it is important to stay well hydration in order to avoid concentrating the blood even further by dehydration. In general, there are no restrictions in physical activity. If person has an enlarged spleen, contact sports may be avoided to prevent splenic injury and rupture. To take iron supplement food. Medical treatment. The mainstay of therapy for polycythemia vera remains phlebotomy. The goal of phlebotomy is to keep the hematocrit around 45% in men and 42% in women. It may be necessary to do phlebotomy every 2 to 3 days and remove 250 to 500 milliliters of blood each session. A common medication for the treatment of polycythemia is called hydroxyurea. Aspirin is usually used in conjunction with phlebotomy. Prevention: smoking cessation, avoid prolonged carbon monoxide. Appropriate management of disease such as chronic lung disease, heart disease, etc. Thank you.
Do like, leave a comment, and share with your friends.